bring the health insurance perspective a bit, yeah? Now, for the average, let's say first time new patient, never been diagnosed with diabetes before, even still in denial, it can cost as high as minimum, I was talking like minimum mess, 5,000 naira every month to get your medication. And this is when you're doing it right. Doing it right is you're disciplined and you can do everything right.
Okay.
But if you're not disciplined, or the diabetes, it starts from, instead of starting from, you need 100, right?
Yes.
Instead of starting from like needing 80, having 80,
yes.
Let's say you start from correct one, or that is just 60 you can do, and you need more sophisticated medication. Let's go about as high as 30K per month.
Okay.
All right. So now you want to do that, and that's just medication, lifestyle, your choice of food, and that anything that makes complications. That's why I'm saying that diabetes can be a huge problem. Once the complications of diabetes start setting in, that's where the real problems come in.
Okay.
Things like now in men, and I know men want to hear this one: erectile dysfunction. Erectile dysfunction and diabetes are like 5 and 6.
Wow.
Once sugar is not well controlled in the body, it affects the nerves, and that affects the male sensitivity. It affects the ability to get and sustain an erection.
Tell me how it affects women.
Now, for women, they're even luckier and unluckier, because there's something called gestational diabetes, which is diabetes that is brought on by pregnancy.
Okay.
And so there are women who how they became diabetes is because they got pregnant. Because pregnancy itself too is a diabetogenic state. There are a lot of hormonal changes in the body. Because there's a new visitor coming into the body. So the body wants to be ready to take care of that visitor too. And in getting ready for that visitor, a lot of changes happen. And in the middle of those changes, stuff can go wrong.
Let's talk about symptoms of diabetes.
Yeah, so there's a trifecta, 3 key things that when we see these 3 things, until proven otherwise, it is diabetes. Excessive water drinking, excessive urination, excessive eating. Plus or minus.
If you drink water too much, you will actually urinate
Exactly.
often.
So this is why is that? And then we say plus or minus.
And the weather can be hot.
Yes, the weather can be hot. So the
dietitian tell us to drink water.
Exactly. So the question is, define a lot of water. Now, for me and you, a lot of water is like what?
Like 8 glasses of water.
8 glasses of water. I don't know what that means, like practically. So that's like 3 liters. What?
Yeah, at least 3 liters.
Okay. Now that's not diabetes drinking water. They're drinking double of that. I saw a patient once who told me that they take like 2 bags of pure water
in a day.
Yes.
Oh wow, that's a lot.
Because the body is trying to flush out that excess sugar. That excess sugar that is there.
It
is so high. The body knows that this is dangerous.
Okay, so now you know that if you drink as much as 2 bags of such a water in a day,
what
you
are
need
you
to check.
1 bag now? Even you that are taking 1 bag. Why? Go to hospital, please. Go and check first. Let them say no, that's not it.
All right then, so let's get down to health insurance now. You had mentioned earlier that if it's still in the early stage, you'll be spending about 5,000 naira in a month for medications for diabetes, and then at the very extreme case, you might be spending as much as 30,000 naira. Tell me how health insurance comes in all of these, and how it can help manage the cost.
And that's if it's not
for a diabetic patient.
That's even if it's not more. So this is on the assumption that the person's cholesterol levels are okay. If cholesterol levels are affected, remember I said diabetes is a problem with the way the body is processing carbohydrates, protein and fat. Cholesterol is a subsection of fat, of fat. And so by the time we add that cost, it balloons. However, because insurance is managed care, it's about pooling resources. Not everybody will have diabetes in the world. Not everybody at the same time or at the same level. And so, if you just start out and you get a good plan, even with the littlest of plans, sometimes you can get drugs free, entirely free, for a good plan, for a good basic personal plan or a family plan. You can get your drugs free, your basic drugs free.
Oh, wow.
Yes, and then after you get your plan, because we see the patients all the time. In fact, a lot of them, and one of the good things about insurance is that it has driven compliance. One of the problems we used to have before is you see the patient who will come and say, I'm sorry, you're seeing the patient that you treated last month, and the patient has fasting blood sugar. And those are the magic words in diabetes. Your fasting blood sugar, your glycosylated hemoglobin. Glycosylated hemoglobin tests what your sugar has been like over the last 3 months. So you see a patient, 70, 80 something milligrams per DL. Fantastic. Less than 100, which is what the target is. Next thing, they disappear for 3 months. Then they appear 253. And you're like, what happened? Doctor, I did not have money. I didn't have money. So you didn't get your drugs. You have to use your drugs. Oh. But that's where we end the conversation at. I'm a clinician. I have to end the conversation there because the other patient waiting for me.
Confirm to
others,
him. Yeah. Others,
and this is where health insurance comes in.
Yes.
So those people are then funneled towards the health insurance system and said, look, instead of you get money out of your pocket every month, a lot of people get, the way people make money sometimes can be very topsy-turvy, depending
absolutely.
on the kind of, so sometimes there are good days, there are bad days.
Yeah.
Buy a health insurance plan on a good day, on a good season, when things are a bit rough and you can come to the hospital.
Covered.
Yes. So all you just need to come to the hospital, sit down, and then just get your medication. And the other thing too is because in the health insurance model, people have to come to the hospitals more often than not to get their medication. They tend to have fewer complications because when things are small, they complain.
Yes.
And these are people that will otherwise not come to the hospital.
If they didn't have that.
Yes, if they didn't have health insurance, they wouldn't come to the hospital. And if they came to the hospital, they would just pick up drugs and go. But because health insurance forces you to come, then they will complain when it is still small.
Yes.
And then we can do stuff about it quickly,
nip it in the bud.
It's fantastic.
Absolutely. So as a medical practitioner, I want you to confirm to us, because for some people, health insurance would only cover things such as headache, such as, just, we can't call it minor thing because there is nothing minor about the health.
Yeah.
Tell me, does health insurance cover diabetes?
Almost every responsible organization doing health insurance covers diabetes to a significant degree.
Okay,
There's
not to a certain level, significant.
Yes, significant
emphasis
degree.
On significant.
Yes. So a significant degree, and I'm talking about where you can walk in, talk to your doctor. Walking in is free, I hope. Talking to your doctor is free. Getting your medication, and it's to you, it's free to you. Free doesn't mean free. Free means somebody else is paying.
Yeah, sure.
So talk to your doctor free, get your medication free, and go home and stay disease free.
All right then, Dr. Odubitan. Lastly, what would be advice to our listeners?
Well, the first thing is prevention is better than cure. Prevention is smarter than cure. Prevention is, in this context, cheaper than cure. So the first step is prevention is better than cure. But where prevention is not possible, the next best thing is early detection, diagnosis, and treatment. And so, don't wait for you to start having to drink 2 bags of pure water. Once you know it is in your family, I beg you in the name of all you call holy, because I don't know what you call holy. In the name of all you call holy, please go to the hospital and do your annual medical checkup. In that annual medical checkup, let them just check for diabetes. If your mom has it, or your dad has it, or your uncle has it, or auntie, or any of your grandparents had it, please. Prevention is smarter than cure.
All right, then, I must say a very big thank you to you there, Dr. Odubitan, for coming on the program. All right, this is where we get to drop the anchor on today's edition of the program. Also, want to thank our listeners for tuning in to Health Insurance Today on Radio, brought to you courtesy A-Star Communications Limited. We hope you found the conversation informative and helpful. Do you know that you can access good quality and affordable medical care, including treatment of diabetes, when you subscribe to health insurance? If you would like to know how to subscribe to health insurance plans for you, your family, or organization, or just want to know more about the topic of today, please call or send a message to 0901 538 8634. You can also email info@healthinsurancetoday.ng. Maximum thanks to Opeyemi Shodunke and the rest of the crew. Big ups to Victor Terry. Don't forget to tune in next week Friday, same time, for more information and an insight on health insurance. Until then, stay healthy and stay informed. I am Taiwo Barua signing out, but still very much within.